Welcome to the number one show and the source of truth for all things MedTech. Here, we reveal the secrets and stories behind the investments, science, and commercialization of the MedTech industry. Every week, we'll take you on a wild ride with the biggest names in the game, from entrepreneurs and investors who are shaking up the market to healthcare providers who are revolutionizing the way we think and practice medicine. So hold on tight and get ready for a journey like no other. This is the State of MedTech. Hey everybody, welcome back to the show. Another installment of our strategic deals series. I started this series because on one side, we like to cover what's going on in the medtech startup ecosystem. But on the other side, there's all these strategics. And when I say strategics, I'm talking about the Johnson & Johnsons of the world, the Medtronics, the Strykers, big multi-billion dollar conglomerates who can really inject capital and, more importantly, distribution and support to some of these startups, whether they acquire them or they develop partnerships with them. I think these days, with the complexities of healthcare, we really have entered the third wave of technology when it comes to finding the right partners to go far when it comes to our driving product adoption. If you're interested more in that topic, just Google third wave and then my name, Omar Khateeb, or, and you'll see an article I wrote about this many years ago. If you want to dive deeper in that, look up the book, The Third Wave by founder Steve Case. So for this kind of episode, there's not a lot of people who have both deep roots in the startup ecosystem and deep ties and connections to the strategics. And Scott Huennekens is one of them. Scott Huennekens is a name that we all know, but for those of you who are new to the show or perhaps new to Scott is a proven leader in the med device industry. He's got more than 25 years of experience as a successful medtech CEO. He's also a chairperson, a board member, serial entrepreneur and investor. I have no idea how he manages his time, because if you just go to his LinkedIn page, you'll see how many amazing companies he sits on the board on or is the chairperson of. He's held a number of executive leadership roles in the industry, and some of the more noteworthy, right, at least in my opinion, what I think really started his career trajectory was that he was CEO of Volcano Corporation, which he guided to their IPO in 2006, and then its sale to Philips in 2015. It was a multi-billion-dollar sale. He also served as president and CEO of Verb Surgical, which was a Google J&J joint venture, and then the president and CEO of Digirad Corp, which is a coronary imaging solutions provider. And so his extensive board leadership really spans across a lot of publicly traded companies, but also private companies. And in total, he's had leadership roles in more than 20 startup, growth, and public companies with market valuations that, if you totaled them all together, is a little over $20 billion, which includes 8 IPOs. And more importantly, and this is something that Scott's very proud of, there have been about, estimated based on those companies, about 20 million patients who have benefited from the therapies and diagnostics of the companies that he's led. He holds an MBA from Harvard University and a BS in Business Administration from the University of Southern California. I've known Scott for a number of years now. He's been on the show in the past, and he's somebody that I really look up to and admire as a mentor, but also as somebody who really understands the industry. And so I wanted to have him back on the show to sort of talk about his view on the strategic landscape and what does the rest of 2023 looks like. Now, before we do that, if you're a CEO or founder and you're in the middle of raising money, perhaps you're FDA clear, you're trying to get some commercial traction, or you're just trying to attract early adopters, whatever that might be, I believe in using social media and network effects on social media to attract investors at scale and attract prospective users at scale. I think there's a way to do it where you can attract both those investors and grow your commercial pipeline so you be successful as a company. This is something that my company has specialized in doing. And here is a quick testimonial from my very first client, which is Moon Surgical. Moon Surgical is a surgical robotics company out of France. When I met them, they were about 30 days out of JP Morgan Healthcare Conference where they were going to go raise money, but they're coming out of stealth mode. We laid down a foundation, developed some playbooks, and they took those playbooks and foundation and really implemented them and got remarkable results, raising a $31 million Series A in the spring, and then a year later, a $55 million Series B with NVIDIA and Sophie Nova leading the round. Here's what their CEO, Ann Ostuit, and Chief Strategy Officer, Jeffrey Alvarez, had to say about the result.
The results were amazing. The traffic that was driven to not just our company site, but also our personal sites, over 300% of what it typically was on a regular basis while we had the campaigns going. We know the results were being achieved, and that's why it's so great to work with Omar.
The level of inbound interest we were getting was substantial, especially from investors. It has only been growing since then. So we've been leveraging Omar's work and what we learned from him continuously in the past 2 years.
So to learn more, go to khateebandco.com and you can find my booking link there. Go ahead and book time with me, or just shoot me a DM or an email and we'll grab some time together. Not everybody qualifies to work with me. The company and the founders have to be at a certain stage. But what I always tell people is that I love working, meeting with CEOs and founders, and no matter what, that may be the first and last time we meet for a while. And so I always try and bring 2 to 3 ideas for free that you can walk away with if, it doesn't seem to work out. But if it does and we're able to work together, hey, what I can tell you is that I really look forward to helping early stage companies get that traction, attract the right investors, and more importantly, get that market traction to help them get those early adopters and those KOLs that really drive the needle forward when it comes to creating a new category and elevating the standard of care. Now, with that being said, let's get on to our episode with Scott Huennekens. Enjoy. Welcome back to the show, everybody. And it's with my great delight and surprise, to be honest with you, that we have one of our earlier episodes back on. Scott Huennekens, thank you so much for joining us. Your episode was listened to quite a lot, and I think you were episode number 3 or 4. I remember we recorded quite early when we started the show, so I'm surprised it's taken this long to get you back. But you're a busy man, so I appreciate you carving out some time. How are you doing?
Doing great. Excited to be back. And, thank you, Omar, for everything you've been doing with the podcast. It's highly beneficial to the industry, for people sharing information, communicating. So thank you. I know we all in the industry appreciate what you're doing.
Oh, hey, absolutely. And it's an honor to talk to a great entrepreneur and investor like you. I always tell your story. You always have such a fantastic story. And I still talk to it to this day, that your keynote at LSI, I think it was LSI 2022. It's probably one of the best keynotes I've heard, because it was so not only valuable in terms of the advice you gave to entrepreneurs, but it was so vulnerable in terms of sharing your story, in terms of where you came from and how you got to where you are. It's still one of my top favorites. So for those who are listening, if you're interested in that, I actually have that as part of Scott's first episode as a part 2. So you can go back to the episodes and find that and listen to it. But Scott, let's kind of get into it. Tough times. 2023 has been a hell of a year. We were finally kind of really out of COVID, but then we had things like inflation happening. We had the Silicon Valley bank collapse. We had a couple of bank runs already. And so it's been a tumultuous year this year, especially when it comes to raising money. And I know strategics are normally in our industry kind of conservative, but you sit at a very high vantage point and deal with so many different portfolio companies. Take it from there. I mean, what are your thoughts for 2023 and going into H2 of it?
Yeah, no, I think that's exactly right. I mean, from kind of the middle of 22 and resetting of interest rates and inflation and trying to tackle that, cost of capital changes have really changed the dynamics relative to fundraising. And my former chairman at Volcano, Ron Machacaria, used to always say to me, face reality as it is. And, Ron was the one who built St. Jude into what it was before getting acquired by Abbott. And, it's that advice of, you can ignore reality, but reality is not going to ignore you. And that's what I've tried to bring to the, 9-10 companies that I'm either on the board or invested in over this period of time. And that is, let's have business plans that extend out our runway at a minimal, if possible, to the end of 24 and into 2025. And because during this period of time, you have this anchoring problem, where people believe this is their value of their company, so they don't want to raise money for less than that value. They don't want to sell their company for less than that. And then you have strategics who say, hey, the market has changed. I didn't want to pay that much, and that's why I didn't buy you at that valuation. Now these are more reasonable historic values, but you've got an anchoring and a disconnect on value, and it takes time to work through that. You see that in other places like the real estate market, where someone anchors to the sale of their price and an offer, or their neighbor 6 months sold something for a certain value. So I've tried to work with my companies on, let's just keep our head down, let's ignore what values are, and create value. And creating value is the most important things. But I think things are more healthy now than they were during kind of the era of easy capital, SPAC IPOs that were premature, et cetera. That was not a sustainable model. And now having all this gray hair instead of red hair, historically values for high growth medtech are 6 to 8 times revenue, and good reasonable growth are 4 times revenue. Lower growth, something less than that. And we're kind of returning to those kinds of valuations. And I think that creates a healthy environment, a more healthy environment than we had before, relative to investing and building companies as well, and managing expectations of employees as well, which is a whole other challenge when you've got a lot of people that were given stock options at certain prices. And now, companies, a number of my companies, Hyperfine, Acutus went public and then have had setbacks in their valuation. And fortunately, we've worked with shareholders and reprice options for employees, so that, now we have alignment of interest between employees as well as investors to build the companies and solve the problems that, we're focused on. So, you're starting to see the semblance of coming out the other side of that. I've in my portfolio, I've had 3 different financing. It's 50 plus million or more this year. Hopefully, in the next couple of weeks, a 4th one in the portfolio that'll have an $80 to $100 million financing as well. So things are happening, and also the pool of capital is kind of broader. Whether it's a term sheet from an Israeli venture fund or a Chinese venture fund or sovereign wealth fund or your standard kind of U.S. based funds as well, which is interesting.
Yeah, I'm glad you mentioned that. I think I'm happy that you made that note that we're in a healthier time. I remember back in the boom years of SaaS from 2021 to 2022. I mean, money was flowing. Let me tell you, money was flowing, and I think a lot of people in medtech were looking at the SaaS industry and saying, "Man, I really wish that happened in our industry." And at least the way I saw it, I'm like, this stuff that does not last. And now we're kind of like in a SaaS winter where, SaaS companies are getting decimated right now by their, based on their evaluations and the current market conditions. And I think that at least for medtech, we never really saw much of that at least as big as it was with SaaS.
Okay.
But I think we're in a much healthier environment. I think that that's better for both the companies and for investors, because the one thing you don't want, I mean, I won't mention the company name, but there's a company that I know that, they raised, a significant amount of money, and, a lot of their employees actually purchased equity early on to fund the company. And they announced that they raised a little over, I think, 80 or 90 mil the other day. People were not happy about that because essentially, it diluted everybody. And so I think doing more with less is a big theme. Kind of shifting over to the focus of strategics, with the exception of Oris, I don't know what your take is on some of these big transformative acquisitions, like in the multiple of billions of dollars. Seems like more strategics are getting conservative, spinning off pieces of their company and saying, hey, we just want to look at more like tuck-in deals that go into our core. Do you feel the same way? Or, I mean, how do you see the landscape with strategics these days?
Yeah, being on the board of larger companies like Envista, we're kind of the second largest multi-product dental company, and we've made a number of acquisitions over the last 3 or 4 years, but we've also made a number of divestitures. So the company spun out of Danaher, was low growth, and we said, how do we create value? Well, some of these segments of that business are lower growth, don't have a lot of prospects for growth. Let's sell those. They can be better run and value created elsewhere, private equity, other smaller players that they're synergistic with. Let's take that capital, redeploy it into higher growth areas. So, we have a fast growing aligner business now that competes with Align. We've made some nice acquisitions in intraoral scanning and imaging, and plays with AI and plays with aligners that are synergistic to drive more growth. So you turn a 2% growing company into a company that, going forward, we think can be a high single digit growing company. That creates value. I think, when a Medtronic gets together with a Khateeb and they go from being a cardiology pretty much only company to then being a diversified medtech company, you have this regression to the mean of the industry instead of being a growth company. So I do think it makes sense for Medtronic to concentrate. I think it makes sense. It would make sense for a J&J to spin out their medical device business and concentrate a little bit more and be more focused in specific areas where you could be a high single digit grower in areas that you're very good. Like, how much, if hypertension ends up being, an incredible market that adds, billions of market cap, that's going to be more meaningful if Medtronic was a cardiology only company versus the large diversified company it is today. So, I think that's part of the equation that a lot of these larger companies are dealing with. They're looking to spin off slower growth, nice businesses that are very EBITDA strong that you can add, debt onto, and they could be nice private equity deals. They then can focus on what they do very well from a, kind of clinical data development, applications development, and then global sales and marketing. But the strategics also need, the rich entrepreneurial innovation engine that they can then go tap into as well to add on or layer on to their business as they go. So at Envista, getting rid of some of the slower growth areas and then tapping into that innovation pool, adding those on, and those become then the layers of growth going forward. And it works as a nice ecosystem collectively. Because, no matter what you say or do, it just gets harder and harder when you're larger, a la, a Medtronic or, an Abbott, et cetera, to do innovation extremely well. People are often more incentivized to manage their careers in their existing business than 4 or 5 year high risk investments that will be the next growth engines. So it works well to have those early stage companies be venture funded and focused and progress along and then be acquired. But then we reach where we are today, where back to that anchoring problem, where I think there's a lot of opportunity, I think, for the larger strategics to be acquiring, but we're trying to figure out what this new norm is. And once we have that figured out, I think we'll start to have a little more active M&A activity.
Yeah, and I'm happy you mentioned that because, it's funny how if you look at physics, physics and math just seems to solve so many problems, and when we look at momentum and acceleration, the larger the larger mass you have, the more difficult it is to change velocity and acceleration. So as these organizations get larger and larger, it's just very difficult to actually innovate. And it's not because they don't want to, it's just it's very difficult. And I think, you see this happening with Amazon where, they made that strategic acquisition of One Medical because Amazon tried to do healthcare on their own and they just realized they can't. Correct me if I'm wrong, Scott, but I feel like a long time ago, Baxter at one point owned they could have been the largest medtech company in the world, but they spun off a lot of their portfolio. One of them was, I think, Edwards Life Sciences, and we've seen how well Edwards has done. Do you feel like this is kind of the new wave that's happening, which is Medtronic, J&J, these larger strategics spinning out some of those companies, and those companies kind of taking on a life of their own, and that'll kind of help the startup ecosystem? Because I would imagine for deals, it's going to be much easier to deal with one of those portfolio startups from a Medtronic than Medtronic itself. Am I right in saying that?
No, I think you're absolutely right. And it's not a new finding. It's actually something that's been researched quite a bit. When I was back in business school, late 80s, early 90s, it was the era of the conglomerate, right? And the ITTs and all, all of these kinds of companies, and scale matter. Once you get past a certain point, the data is now there. Scale doesn't matter. It actually inhibits you. And you become too internally focused versus externally focused. And there are different dynamics that develop with customers. So you take an Envista, for example. It's part of Danaher. Danaher is a phenomenal company, like one of the best companies in the world, best track record over the last 20 plus years, how they've acted that company from an industrial company into a healthcare company, and grown. They're very diligent about their capital allocation. But you take an Envista, a dental company within a medical device company that was more focused in other areas, we were kind of lost against these direct competitors like Straumann. Straumann's a dental company with focus, and the customers wanted to deal with a dental company, not a conglomerate per se. And so now that we're Envista again, we're now a dental company. We're focused on dental. We're your dental partner. You know that president of that division isn't going to change every 2 years and go from, back when Volcano, we were dealing with GE. There was a new president of GE Healthcare every 2 years. Someone would come from locomotive. Someone would come from, some other, power engines division or whatever, and didn't know healthcare. Or when J&J was our partner, also at Volcano, every 2 years there was a new president of Cordis, and they came from, Neutrogena, or they came from pharmaceuticals. And, there's a lot of domain experience that, gets underestimated. So these conglomerates where, Medtronic's strictly a medical device company, that works better than, something like a J&J, which is pharmaceutical, consumer, med device. They've now obviously spun off their consumer business. But, I would argue that, and I think a lot of investors would argue as well, companies would be better just being med tech companies, pharmaceutical company, consumer company, as an example, because you can stay focused in your areas. And then if you become too, dispersed as even a strategic, it becomes very challenging to have 6 different verticals that you're operating in. If you look at the biggest success stories from growth, here over the last 20 years in medical devices, who are they? Edwards, spun out of Baxter, focused on cardiology, not just cardiology, focused on valves primarily, with a smaller monitoring business. Dexcom didn't pollute itself by going into all of these different spaces. Diabetes focused. Intuitive Surgical, very focused on surgery, very focused on robots. ResMed, very focused on sleep apnea and these are the, now those companies had big enough markets where they could grow into these, 40 to $70 billion market caps without having to diversify. Back at Volcano, being a precision guided therapy for interventional cardiology procedures, our peer was only so long, and you're running to your peer. The end of it, and your growth is going to become the market's growth at a certain point. So you have to add on additional layers to continue to grow. And, that's what, Philips bought us in that case, and we were a new growth engine. And that business over the last 5-6 years has grown from, a $450 million business when we sold it, growing 20%, to now, a $1 billion business within Philips, and been a nice growth driver for them. So that's the ecosystem and how I see it working. And I'm excited the next number of years are going to produce a lot of value, bold companies that will either grow and be the next Intuitives and Edwards, and or will become, part of these larger conglomerates. And, you look at companies today like Penumbra, which continue to grow, and, you'd rather continue to grow and not get bought. But at some point in time, you're likely to get bought by one of the larger ones, or you have to add layers on and become one of the larger ones.
Yeah, I think that's a great, it's probably the best synopsis I've heard of in terms of just like encapsulating like where we are right now. And I think, as the saying goes, like the riches are in the niches. And I think that I've seen plenty of companies who failed because they didn't have focus, but I don't think I can find too many companies that failed because they were too disciplined in where they focus. I think Intuitive is a great example of that. That they had a robot that could be used for a lot of things. They decided to just focus on prostatectomy, own that, and then when they launched Ion, it just made sense for their business model because it's like, okay, we have this robot that helps with diagnosing something and finding more cases that can then convert into Da Vinci cases. Like, that's smart. That's a great business model. I can pick on Intuitive for different things. I can't pick on them on their discipline and their business model. And I feel like that might be the next like big thing, which is instead of just, I don't know, at least in the 80s and 90s, it just seems like conglomerates were just like, let's just acquire a bunch of stuff. Now it's a lot more discipline when it comes to investing. Do you feel like the more strategics are focusing on that discipline and focus of, does this make sense for our business model?
Yeah, absolutely. No question about it. And I also think they've gotten bigger than earlier in my career. So
really,
well, if you look like at Boston Scientific, look at their scale of revenue 20
that's
years
a great,
ago
great
versus
point.
today. And so something that, it takes a little more to move the needle there, or, you got to have a commitment that you can see where over a 5-year period, it's going to move the needle to create value. So, we used to, have this chart where, hey, here's, the companies that are 1 to 5 billion, here's 5 to 10 billion, here's 10 billion or more. Some of these are going to move up. We need to move up there because some of these guys, like take Abbott and St. Jude, they come together. Khateeb and Medtronic come together. Now this group shrinks. So you need some of this group to move up here, some of this group to move up here to keep the ecosystem healthy, because a deal at Volcano, when you're 400 million and you say, hey, I can buy something that has 30 or 40 that can grow to 200, that makes sense. That deal as part of, one of the 20 plus $1 billion companies doesn't really move the needle much at all. Now you take an Edwards, which is announced publicly, how they want to go into some other adjacency areas and have made investments in different technologies to develop or acquire in. That makes sense as well, to develop these new areas, new platforms for growth.
Now, 100%. So here's my let me introduce the topic. I'm a Mazor guy. That's where I started my career. I was early years in Mazor. We pioneered, robotic spine surgery, and then we were competing with Globus. That all being said, as much as it pains me to say this, and I know I'm going to piss off a lot of the Mazor people, but guys, I'm just going to say it. The moment the Mazor got acquired by Medtronic, right, it wasn't the same company. And I think that they weren't as aggressive and they weren't as focused as they should be. And as a result, I'd say starting from 2016, Globus whooped Mazor's butt in terms of the adoption. It pains me to say that. Now, that being said, a lot of the people, again, retaining talent is a big part of that. A lot of those talented people, the majority of them ended up leaving once the acquisition happened. A lot of decisions, at least, again, I didn't work inside the Medtronic when that happened, but I think that when you start bundling the technology with huge contracts and everything, you don't respect the technology as much, and then you don't have true champions. Globus didn't do that. Globus found a way to stay independent and really be aggressive about focusing on, we are a robotic spine company. That is it. That all being said, when I saw the Nuvasive merger and acquisition, it's a merger. It's a merger. When I wrote about it first over a year ago, I had mixed feelings about it. Here's the pro and con of it. The pro side, I'm like, this is awesome. Globus didn't really have a good, from my anecdotal experience, their implant side, from a customer service side, everything wasn't that great. Nuvasive, their whole tagline is speed of innovation. They have great products, great culture, and everything. So when that happened, I was like, man, that's a really good merger. However, that being said, that's a really complicated thing in terms of how do you stay focused as an organization and how do you merge these two cultures together? Not the same thing, but like the Stryker Mako deal, great deal. That was a messy deal for many years. So when you have these mergers happen, what are the most important things you got to do to kind of make sure that you kind of keep that culture of innovation and speed and competitiveness going without distracting people? Does that make sense?
No, I absolutely. And again, like I referenced before, there's a lot of data on this, taught in business schools, books written on it, on M&A and M&A deals, generally speaking, not living up to the projections that justified the price. And it's multifactorial relative to, synergies of the technologies and sales and distribution, or market changes, people that leave, et cetera. But if it's all kind of relative to scale, like a merger of equals or a merger of two large companies is different than, a bolt-on technology at Volcano. But at Volcano, we used to always say, we're not doing any take outs. We're only doing take ins. And we only wanted to do that if, Paul Mannion wanted to come work at Volcano and build this out. And he was willing to take incentives that were going to last the next 3 years as part of that process of us buying that and putting it together with our products. And I had to have a very good feeling that the products, maybe our product was 4 and his was 1, but 4 plus 1 equaled 6 or 7. And we wanted to, buy companies that were led by people and had cultures that were similar enough to ours, that you wanted to go to dinner with the person, you wanted to go have a glass of wine or a beer with them. You didn't dread those kinds of things. So, that gets harder when you're talking about larger, and it's your J&J buying something, Medtronic buying something, Philips buying Volcano, a Dutch company with a U.S. innovation, Southern California company. There's going to be cultural, differences. In that case, they didn't have an interventional business, so the Volcano team and Press didn't have a lot of overlap. Same thing when they bought Respironics and sleep apnea. Those things could run almost as independent and have some of the benefits of the overall Philips connectivity, for example, or in the case with Volcano, Philips' market share in selling angio suites with their X-ray systems went up because Volcano reps were there every single week versus a Philips person who's there every 4 or 5 years when there's some new piece of equipment. So it's looking at those other synergies as well. Look, Nuvasive has a very different culture than Globus. Globus has a great franchise, in trauma that Nuvasive has. Nuvasive has a strong franchise in cervical that Globus doesn't have. Lateral, Nuvasive has a super strong franchise. So the product mix fits very well together. The customers overlap very minimally and beneficially. But part of the process here will be the merging of two different cultures over time to create what I think will be, an incredible spine company that's going to drive innovation and drive benefits for, surgeons and patients here over the next 10 years post-merger.
Yeah. We'll see what happens. And I was pretty excited about it. And again, as a guy who's pro robotics and stuff, even though if it was like a former competitor, I'm really excited about it. At least at the time, even at Missouri, we didn't see Globus as a competitor. We felt like we're both fighting against the status quo, which was like freehand surgery. But I think, we'll see. I hope you're right about that. When the merger happened, the first thing I thought was that might slow them down, but I don't know. I kind of pick these sort of heavyweight boxing matches. So I kind of want to see, I want to see this go well. And then I want to see, I would love to see Medtronic just say, hey, we're going to spin out our spine business and then just see whatever that business is, go head to head with Nuvasive Globus. Cause I just feel like, I don't know, in the world of competitive, med device, and in the end, I feel like the patients benefit because they're going to get the benefit of the best innovation, right? Being driven and adopted. Do you feel like there's some other areas of medtech that we might see some similar kind of mergers and activities going on outside of spine?
But hold on to that question. But back to your point,
Oh, yeah.
I'll try and say something a little more provocative. Look, if Medtronic were to spin that spine business out, that I'm sure pre-merger of Globus and Nuvasive, Globus and Nuvasive would have said, "Oh, that we don't like that. That's what we want our competitor not to do." Now
Right.
that becomes much more competitive situation and competitor to us, or if J&J similarly spun out, their spine business or their whole orthopedics, business with trauma and everything else. I always ask myself, what would I like my competitor not to do, that would make them much more competitive to me. I used to love at Volcano competing against Boston Scientific, and people would say, geez, you're just this little company, Boston Scientific's this, 800-pound gorilla in interventional cardiology. But the problem was, like, it didn't matter what they did in their IVUS, business. They had to do well in their stent business. They had to do well in their defibrillator business in order to make plan. So that's where people are going to get paid the commissions. That's where they're going to want to go to work. So it made it easier, to compete with them. Similarly, this whole world of circulatory support, there's a lot of venture funded companies, and I'm sure all of them were clapping, doing backflips, and excited when J&J bought Abiomed, and then did double backflips when they saw Mike Minogue wasn't going to stay there. It was like, okay, Abiomed is not going to be as competitive going forward the next 5 to 10 years as part of J&J, and they're surely not going to be as competitive without a fiery, talented, strong, smart, leader in Mike. That's no knock on Abiomed. It's just going to be harder for them within the constraints of J&J's quality, legal, financial, et cetera, things to innovate and drive things. And I hope I'm wrong. And I hope that J&J, continues to do super well with that asset to the benefit of patients. But, that's my prediction based upon what's happened with them in orthopedics, what's happened with them with Cordis in cardiology, what's really the only place where they haven't, hurt the innovation and market share in the med device space is Biosense Webster, where they are just, the 800-pound gorilla as it relates to EP and AFib. Yeah. But back to your question. What was back to the question you had?
Oh no, I have a more interesting question than that one. I was asking just in terms. So I have a more interesting question actually, because this is why I love talking to you. What's something that you see going on right now in the market? Let's just keep it on strategics that you are willing to say, but most people are thinking but are not willing to say.
Say that one more time.
What's something that you see going on in the market that might either be frustrating or just this is the right way to think about it or do things? Something that everybody is thinking, but nobody is, let's just say, brave enough or has the chutzpah to say, if there is such a thing. I feel like there is. I think that there's plenty.
Oh, there's plenty of them. And the thing I'm most frustrated about in my career, 30 years, is the friction that exists in making right choices versus economic choices for physicians and patients. And it's infuriating to me. So if you go back to Volcano and you say, hey, we know we're putting in twice as many stents that are necessary. Our rate of stenting here versus in the US versus Europe, for example, the number of people who are getting stents, the number of stents put in the person are significantly more. And the reason for it is reimbursement. So then you come with a technology like IVUS, which will tell you, or FFR, which told you who really needed to be stented, not stented, FAME 1, 2, 3, New England Journal of Medicine. Clearly, this is the way we should decide if someone needs to be stented or not. In 20 years, this will be the standard of care. We know people will use IVUS in these kind of cases in 20 years, but it takes 20 years because, a Kaiser who's the payer and the provider will adopt the technology, and Volcano products and at that time, Ratty products are getting used in 50% of cases, but HCA, they're only getting used in 4% of cases. That's just horrible. That means, these people at HCA are getting overtreated, introducing different clinical risks. Or if you go to them and say, hey, if you use FFR, you can reduce the number of bypass surgeries, by 30 or 40%, because now they don't need 3-vessel bypass. They only need single vessel stenting. Oh, well, now I'm going from a $45,000 reimbursed procedure in revenue down to $11,000. No, thank you. Come back later when it's further the standard of care. You just see examples of that continuously. I point this out to a lot of friends who just are can't believe it. And I say, going back to like, peripheral SFA, treatments and the like, I'm like, how many Fox Hollow procedures are done in Europe? Like none. How many are done in the US? A ton, because it got reimbursement. Well, that's not sustainable. That's not likely a true, therapy. There are certain patients that it may be beneficial for, but not at the rate that it's getting used. And there's plenty of examples of that. But I often tell them, look what's going on in Europe for an indication, because people are making more rational decisions. They're not making economic decisions to make more money so they can go buy their vacation house or, do whatever. That's not all physicians, but there's a significant number of physicians out there that, or hospitals and CFOs that drive decision making, like this. Another example, I mentioned ResMed earlier. ResMed introduces a home kit to do a sleep test, and it's a couple $100. Instead of having to go to a sleep center, spend all night there, it costs a couple $1,000s. Well, to get people to change that is incredibly time consuming, expensive, in order to accomplish that mission. We're facing the same thing now. I'm on the board at a Lucid. You have a Lucid, Heartflow.
I was very excited about that, by the way. I'm an full disclosure, I'm an early investor in Lucid. So when I saw that announced, I was like, my man.
Right. Yes, my first startup was a company, Digirad, and we made the first solid state gamma cameras for nuclear cardiology. And we were moving procedures from hospitals to doctor's office, but we're also transferring them from someone having to go do an angio. They now could have a non-invasive procedure. So you went from a $4,000 or $5,000 procedure to a $1,000 procedure in a physician's office. And now you can have a CT FFR, cheaper, faster, easier, non-nuclear injections. And again, you've got this whole community of people who look and say, hey, I don't want to give up my $1,000 to $1,200 myocardial perfusion image as part of my revenue stream of my cardiology practice or hospital, and replace it with a CT FFR where I may only make a couple $100 instead of $1,200 off of the procedure, even though it's better, faster, and easier for the patient. Then you see in Europe where it's being adopted faster than the US. So I think we really, as an industry, need to be doing whatever we can to help identify these issues and push, but it's also the medical societies and the like. And look, we're in a regulated environment where it's high stakes with patients' lives and their care and outcomes. So I'm not endorsing a go super fast like a consumer market where you introduce beta versions of products and then fix the problems because there aren't lives at stake. Not at all. But at the same time, I think we need to recognize that in the US our reimbursement system is set up to overtreat and to overdiagnose patients.
Yeah, and I mean, look, it's
correspondingly then really, really important technologies from a diagnosis standpoint, especially, don't get funding and don't get developed, and that further exacerbates the problem.
No, I absolutely agree. No, I'm glad you mentioned that. I mean, this is one of my former companies, Petrera. Why I was so excited to work for them is that they were more focused on predictive health, right? And personally, I mean, this is Omar Khateeb's personal opinion. I want people in this industry, both physicians, med tech entrepreneurs, everything, to make a lot of money, like vast amounts of money. And the reason why is that we're in competition with the rest of the industries. And I'm tired of seeing extremely talented people, engineers, entrepreneurs, and everything, go into tech. Like, who cares if you come up with like a new social platform or some BS marketing SaaS product, right? I'm kind of tired of seeing talented people go that way. And so I'm very capitalistic in terms of like people making as much money as possible. But again, it has to be done in the right way. And I think, for a lot of med tech, entrepreneurs have to ask themselves, like, is this an incremental improvement or like really transformative improvement? And then are we really making healthcare better, not just in terms of the treatment of the patient, but like, are we doing this faster, cheaper, at a higher quality and efficacy rate, right? I think those are like really hard questions to ask, but I'm hoping that with this convergence with tech, big strategic spinning out companies, we start seeing more innovation. Because I feel like the last 10 years, like we've seen some innovation, but I don't know, maybe it's me, I'm biased, but I feel like in the last 2-3 years, something's different. Do you feel the same way?
Something's different in what regard?
In that there's more exciting, like I haven't felt this level of enthusiasm and excitement about innovation in the space for like a while. Like something happened the last couple of years. I don't know what that is. And maybe it's just me.
Yeah, I have been excited my whole career, and
me too, Scott. But like,
and equally excited. In the sense of two things. Number one is that we're all building and standing on the shoulders of the people that came before us, both in each specialty and vertical in healthcare, as well as the tech, which the tech often comes from other industries, and then we get to apply it at its faster, smaller, lower cost based upon its use elsewhere. So to your point, if I look at the 1990s, the 2000s, the 2010s, now the 2020s, I am 10 times more excited about the 2020s and what is possible in medical devices and in healthcare, because of all of the opportunities in tech primarily. I'd say that's 80% of my excitement. AI, big data, connectivity, cloud computing, robots that have been mentioned, all the different interfaces with AR, VR, haptics, nanotechnology, new advanced materials. We got to be thinking about the environment, and there's clean tech and different ways that we can do and use resources more effectively here. So I could go on. There's 30 technologies. I was just reading this paper a couple of weeks ago that are expected to be 10 times better here in this decade, from faster, smaller, cheaper, more accessible. So that's 80%. Now go look at those technologies and how they apply in other industries. How could they apply to your business? How can you transform your business and your products and technology? And that might be the business model, that may be the product, that may be the service, all three, to create a snowball synergistic effect to do what you said, which was better outcomes, cheaper outcomes, more accessibility to patients. Then there's this 20% part that I think gets overlooked. In 1990, when I started at Edwards, you had to do all of your own R&D. You had to do all of your own manufacturing. You had to do all of your own regulatory, all your own clinical trial. And you basically had two markets, the US and Europe. Compare that to the 2020s. You can outsource your R&D to the best people in the world cheaply. You can outsource your manufacturing cheaply to manufacturers at scale. You've got great companies like Verinex and others who will do your clinical regulatory work for you that can be managed by you, and CROs and the like. And you have geographically, way more opportunities from the Japans, the Chinas, the Asias, Latin Americas, et cetera. And your capital sources are now global as well. And with all these technologies like connectivity and the like, you can have an employee base that you can tap into that's dispersed as you move forward. So you put all those things together, and it allows you to do things cheaper, faster, and easier to develop, products and technologies. So that's what gets me really fired up. And if as I'm saying that, I'm looking at, whether that's hyperfine with portable MRI, where we're using, magnets that weren't thought to be able to generate the quality of images because we have, horsepower associated with them, and computing power and AI to drive image quality. And that's going to change where we can do MRIs, accessibility. We've now sold, I think, 30 plus systems to the Gates Foundation for Africa, but being able to have one of these in every ER for stroke identification over time, or, Acutus and the computing power, back to, AFib. It's just like stenting where we had, balloon angioplasty and 50% success rates, and drug-eluting stents originally 65, 70, and now we're at 98, 99, and we're treating the right patients. AFib will be there, I think in the next 10 to 15 years, because we're going to get way better at mapping, pre-treat, evaluate, treat, and have a better control view there to solve this. And it comes from advanced materials, AI, better sensors, all things that weren't possible, 10 years ago. Or you take, a company like Foldex. Are we going to still be putting animal valves in people, in 20 years? I don't think so. I mean, we've got synthetic materials now that can be more durable, more compatible with the human body, with a robotic manufacturing, can be made for a couple $100 to the exact size that is needed, so you can have personalized medicine. So there's just all these, super interesting opportunities across every specialty, really, to enact more access, better cost, better outcomes in med devices. So, I get fired up every day to go work with all these companies.
Look, man, I'm with you. I mean, I left the industry for like a year and a half. I tell people that was kind of like my undergraduate time away. And when I came back, some of the people in SaaS are like, dude, why, you're leaving tech and SaaS, why are you going back to medtech? I'm like, man, we're gonna hit boom years. Like medtech is gonna be great again. Because I feel like the last, in the not 2000, but late 2000s, the 20s right now, a lot of attention was diverted to tech and whatnot. But all these huge multi-trillion-dollar companies, Apple, Google, Microsoft, Amazon, right? They're tasked to grow. Amazon's not going to wake up tomorrow and they're going to say, hey, we should go into the furniture business. The last frontier, which I feel like in a established society, the last frontier is we start chasing death and start focusing on healthcare and medicine. And then something, if you want to call it the zeitgeist, happened the last few years. You had Andrew Huberman, Peter Attia, and then if you look on Instagram and TikTok, all this explosion of longevity medicine, biohacking, and little by little, there's more interest from the public, not just on the longevity stuff, but actual med tech. And so with this attention, it's going to bring, I'm predicting, a lot of talent, a lot of money. Funding is now a commodity. So you don't have to raise, capital just from a VC. That you can do equity crowdfunding. There's so many things. Plus, to your point, back in the 2000s, even 90s, it was hard to start a med tech company. It was really, really difficult. Now with technology, it's just become so much easier. And so I'm so excited for our industry, Scott, and I'm grateful for people like you, because technically at this point in career, you can just be kind of hanging out down on the beach and just taking it easy. But I feel like you're busier than ever these days, and so I'm grateful for for entrepreneurs and investors like you that are staying in the industry. And it's kind of reason why I want to have you on the show and kind of talk about all these
Omar,
awesome things.
I tried the beach thing, but as a redhead, I tried to get all these I tried to get all these freckles to grow together and have a tan. It didn't work, so I'm back to work. But look, and that's I've worked with MDMA. They do a great job. Advamed does a great job. I don't want to discount the fact that we deal with these sterilization issues. We're dealing with Medical Device Act. We're dealing with changes in European regulatory environment approval processes. There are a number of externality challenges that make it harder for us, and we need to keep working on mitigating those and eliminating that friction so we can make the progress in the reasonable amounts of time to generate the returns for the capital, so that we continue to have the snowballing effect with innovation happening, to support the larger strategics, or for the strategics to be making their own investments as well. And there's some different models being pursued there, like Verb Surgical, which was J&J and Google. And J&J realizing they couldn't do that innovation within the company, and partnering with Google and creating a company, Verb, which we've done. And then they do that as a build to buy. And, at Huennekens, I mentioned earlier, where we do outsourced R&D and we do clinical and regulatory. And now we're in discussions with multiple large strategics to say, hey, we can take some of that stuff out of your income statement, take it to the balance sheet, we can do those projects for you, and you can create more leverage to get more done on the innovation side. So I think we need to keep challenging the business models as well on what can work to go faster and bring more innovation to the market, because the opportunities are clearly there.
No, absolutely. And Scott, we're in an hour, and again, I want to be mindful of your time, but you are definitely on a roll. Do you got time for one or two maybe quick questions?
Sure, let's do it.
See, I got to put you on the spot like that because nobody's going to say no to that. So here's an interesting one. For me, I feel like it's not a talent thing, although it is a talent thing. There's a certain level of energy needed as a board member and investor to help more than, let's say, one or two companies. You're like a Michael Jordan for this, in my opinion, because you have the energy and talent to help so many different companies. For those who are interested, just go to Scott's LinkedIn and look at his banner. Those are the companies that he's either serves as an investor, board member, chairperson, or all three. I know you love all your children. I know they're all your friends, but can you pick one company that you're now helping that you're really excited? I know you're excited about all your companies, but maybe take a moment to talk about one company in specific in terms of the problem they solve and what kind of attracted you to them. Because again, from my perspective, I always wonder what does it take to get somebody like a Scott Huennekens on a board of a company? Like what needs to be seen aside from a great investment? There's a lot of great investments, but yeah, if there's a company you want to talk about, what would it be?
Wow, that's just not a fair question.
I know it's a terrible question,
but children, Caitlin, Lauren, and Jared, like it would be saying like, hey, who's your favorite kid? They're all great kids. They all have.
You can pass that. I'll give you a pass on that question. You're my friend. No, I'll let you pass on that question.
I'll say this. I won't say it's favorite or anything, but I'm super excited about the Lucid, and I'm super excited because it's a culmination of a lot of work and vision in my career. So if you go back, to my early days in Digirad, it was, hey, let's try and find, at the top of this funnel, the patients that need interventions and need different treatment for cardiovascular disease, because we're trying to eliminate heart attacks and we're trying to decrease cardiac morbidity and mortality over time. And so, spent a lot of time at Digirad doing that and getting people into the funnel and diagnosing them better than before. At Volcano, our dream was to eliminate the volcanoes going off. It was to find these plaques that were likely to progress, rupture, and cause heart attacks. So we spent a lot of time and energy on that. We helped do who should be stented, how you should stent, and dramatically improved clinical outcomes for interventional procedures. But we did not we had the New England Journal of Medicine prospect trial, Greg Stone, PI, great trial with Abbott, 3,000 patients, first large natural history. We knew these 20% of plaques caused events within 2 years, but you had to present in a cath lab you had to declare yourself in order to then have the diagnosis. You needed to be able to go fish where all the fish were in the wild, not in a hatchery, so to speak, in a stocked pond, in order to really materially affect trying to find patients that you could manage their plaque progression better based upon what that plaque was, and or determine who is likely to have events within a few years and start to get after those. CTFFR with Heartflow clearly in a Lucid, we're tackling that problem, given now with what we can do with computing power, what we can do with AI, connectivity, et cetera, to really identify and understand these plaques better, and with advancements in pharmacologic approaches, better manage them to slow progression of disease. And then if they're further along, we now can tackle who to intervene on, how to intervene, and new interventions could become possible based upon having these targets that didn't exist before. So that's 25 years of work of my career to want to be able to do that, and that I've been working on. And I think, we're getting within shouting distance of making significant progress there. So the Lucid is, and we're early pre-revenue, and so it's an exciting time. And I think I'm very confident we can create another unicorn. And unicorns are great in creating billion-dollar value companies because it means there's hundreds of thousands of patients, if not millions, that benefit in order to create that value.
Below, but I think that's the best way for people to kind of follow and keep up with you is on LinkedIn, right? No TikTok or anything.
No TikTok, no Instagram. I'm too busy.
Yeah, I know. Seriously. Well, hey, Scott, thank you again for coming on the show. Everyone, Scott Huennekens, I'm your host, Omar Khateeb, for the State of MedTech. If you haven't already and you're a regular listener to the show, you know what I'm going to mention, right? You have to review the show. We're the #1 show in MedTech for a reason. Give us that 5-star review. Write a short review on Apple. And more importantly, go ahead and subscribe because not all our episodes are promoted. We have a lot of quote unquote secret episodes that only subscribers get. Subscribing is for free. So whether this is on YouTube, Apple, Spotify, Android, whatever your platform is, hit that subscribe button, give us 5 stars, and we'll see you online later. Bye for now.
Thanks, Omar.
Thank you for enjoying another epic episode of the State of MedTech. If you're feeling inspired and love this episode, do us a favor, hit that subscribe button and turn notifications on so you never miss an episode. And be sure to give us 5 stars and write a short review because that helps more people discover this amazing community of ours. If you're a company who has an executive that you'd like to be on the show, or perhaps you want to sponsor one of the episodes, shoot us an email at hello@khateebandco.com. Take care, and we'll see you next time.